Okay. My case presentation is on chronic hepatitis B related hepatocellular carcinoma. And since I have just 5 minutes, I would just delve straight down to the summary of the case. And this patient was first diagnosed in April 2013 at the age of 41 during a blood transfusion screening. And at baseline assessment, he had hepatitis B viral load of 3,293,000, and he had deranged liver function test, in which his ALT was 61, AST was 50, and then gamma GT was 70. So he had low platelet count and with an unremarkable abdominal ultrasound scan. And FibroScan score was unsuccessful because he was obese. We did his APRI score, which was 1.276, and he was hepatitis E antigen positive, but hepatitis C and HIV antibodies were negative. He had normal creatinine, and hepatitis delta was not done at the time, and he had no known significant family history. So a diagnosis of hepatitis B, chronic hepatitis B related liver cirrhosis was made, and tenofovir was started. He was followed up and assessed every 3 months on treatment, and he had a normal urine dipstick. After 3 months, his hepatitis B viral load was significantly decreased to 165,580, and his ALT was 56. So with excellent adherence to tenofovir, he was monitored every 3 months. And after a year on tenofovir, he was assessed, and he had his first successful FibroScan score of 14 kilopascals. And then his viral load also further reduced down to 56,000. His FibroScan score gradually regressed in subsequent years, which were fluctuating between 7.7 and 9.6 kilopascals in subsequent assessments. And we did a comprehensive assessment in 2018, which showed hepatitis B viral load of 1,881. And then his FibroScan score was 6.7. His ALT was 44 and AST was 68. We did his AFP, and then which was 1.67. His platelet count was 65, and abdominal ultrasound scan was again unremarkable. And his hepatitis B viral load in 2019 was undetectable, and then FibroScan score and liver ultrasound scan were both not remarkable. His LFTs were within similar ranges like the one for the year prior. So he presented in clinic in October 2020. This was 10 months after his last assessment and 7 years on tenofovir, with complaints of a 5 days history of abdominal pain, bloating, and early satiety. Abdominal ultrasound scan found hepatomegaly with a nodular mass, and then a CT scan was done with contrast, which confirmed a heterogeneously enhanced liver with solid right lobe mass, which measured about 3.2 by 5.5 centimeters with moderate ascites. And hepatitis delta serology came back negative, and then a diagnosis of hepatitis B related HCC was made. Then palliative care was started, and arrangements for referrals and fundings were made. But however, patient died 3 months later in January 2021. Thank you.